Welcome to the Performance Prescription Podcast. Today, we're really excited. We're talking with the team at Central North Alabama Health Services Incorporated, or CNAHSI. We're going to talk about what community health really looks like, especially there in Northern Alabama. We're going to talk about what that means beyond the common misconceptions. We're going to get into the day to day work of expanding access to care. There's a lot behind that. And with that, we have the team here. Can we have each of you briefly introduce yourselves? You mention your role, and then what does the organization mean to you when you talk about like what impact you're having in Huntsville and the North Alabama community?
Jared, thank you so much for having us. I'm Paola Rios, Director of Public Relations and Marketing at Central North Alabama Health Services Incorporated. In my role, I help people get connected to healthcare. And I think what we mean to the community is we are a trusted medical home. We've been around since 1982 and committed to our mission and providing access to quality healthcare services. So when you've been around for that long and you remain rooted in community, you build a relationship with your community and there's definitely trust involved.
Hi, guys. My name is Dr. Kathy Cornelius. I'm the Chief Medical Officer here at Central North Alabama Health Services Incorporated. That's a mouthful. And as the Chief Medical Officer, I'm responsible for clinical services supporting the providers and some of our various patient and quality programs. And Central North is a important part of the community because we are not just a healthcare provider, we're a partner. And we partner in treating generations of patients, so not families, the parents and the children. And not only are we preventing and treating diseases, but we're also focusing on wellness and prevention.
Hi, everyone. My name's Nicole Kuzmicic. I'm the Enabling and Outreach Director. My primary responsibilities are related to community partnerships and collaborations and helping patients connect to needed resources that impact their access to care. I think the community sees us as trusted primary care providers who are there to listen to them and to help them have better health outcomes.
Thank you, Nicole. Dr. Cornelius, Paola. I'm just going to jump right to it. I've got a question for Paula. So when people hear your name, they hear Central North Alabama Health Services. What is the biggest misconception that people typically have about your FQHC?
There's several misconceptions, Jerry, but I think one of the most common one is that because we are mission focused, because we are nonprofits, because we are federally qualified health centers, that somehow means lower quality care. And that's just not true at all. We are a federally qualified health center and we're regulated by HRSA. We receive some funds from HRSA. And because of that, we are expected to have a level of care and be equipped to take care of our community. Also, in 1998, we received our Joint Commission accreditation. It's a rigorous accreditation process known for best practices and patient safety. So we earned that in 1998, and we have kept it up since. That's every 3 years we get audited. And lastly, I think notably is also we are a patient-centered medical home certified. And what that basically means is that we provide healthcare in a coordinated way where we're looking at people like real people, their whole person healthcare, full needs, not just for that one visit, not just when they're sick, but how do we keep people healthy over time?
Certainly, those audits and certifications are kind of a big deal, aren't they?
They are. And I think people are surprised a lot of times when they realize that we have that accreditation and that certification as they're entering into our healthcare system.
Well, Nicole, what would you say are the biggest barriers that the underserved populations are facing when they're trying to access care in your community?
I think one of the major barriers is related to transportation. We serve a lot of individuals who are in rural areas. And so jumping on in a car, on a bus, it just is not an option for them. And then the costs associated with that. People do not have access to cars, and then just getting to us is sometimes a challenge that we see when we're trying to facilitate. I would say a second challenge that patients face a lot is just the cost and the unknown, not having any idea what a copay is or being able to afford even $25 or $50 for a copay, and then the additional costs that are associated with medication, labs, and those type of things, lab results. Thirdly, I would say patients are just unaware of the services that we offer. They do not know that we offer services outside of medical services, that we have pharmacy services, lab services, and how to access them. They're just not aware, even though we do try to do a good job partnering with the community and public relations. We just do not know that these services exist.
As far as the other challenges like transportation and just the flat out cost of services. So how do you overcome those barriers?
We partner with people in the community. So we have a relationship with United Way, and they offer transportation services through 211. We can get transportation for follow-up visits from emergency room visits or just regular checkups. We also sometimes are able to provide bus tokens for individuals. We have good relationships with churches who can help with shoe drives or utility bills or down payments for an apartment or rent assistance. So our community partnerships really do a lot to support the needs that our patients have.
So what are some programs or services that you offer that people might not know about but could really help make a difference with their health?
One of the programs I think makes a big difference for women in our community is the Alabama Breast and Cervical Early Detection Program. It's a no-cost screening program for breast and cervical cancer for women to get free pap smears and free mammograms. And almost every year, we're able to help women with early detection so that they can fight these cancer diagnoses. Another very critical program that we offer is a 340B pharmacy program, which offers medication at a very low cost, which is important and goes hand in hand with our medical services. A patient with diabetes can get a 3-month supply of insulin for $12 to $15. And this would be a deal breaker, a game changer for them having controlled diabetes.
Yeah, that's great. So, Nicole, let me ask you. So, how do your partnerships help Central North Alabama Health Services Incorporated to support patients when their needs go far beyond the clinic visit?
Our partnerships, we try to have a very varied relationship. We have relationships with the North Alabama Food Bank. They will have a food drive where we do dry, non-perishable goods. Sometimes we have a produce truck that will come on site and patients can walk up like farmers market style and pick out their own produce, which food insecurity is a big issue, and also the cost are just going up. We also have good relationships with churches. They've done shoe drives for our kiddos going back to school, paying utilities, rent assistance. So we really lean heavily on connecting our patients to these local community resources.
So, question for both Paula and Nicole. From a marketing and outreach perspective, what have you learned about reaching people that may need care but may not know where to start?
From a marketing perspective, it kind of just speaks to everything we've been talking about today, that you have to reach people before they get sick. You have to show up consistently. You have to partner with people. You have to get to know your community. Some individuals, it may be fear-based, and some other individuals may actually have barriers. So when creating marketing campaigns, you have to take those things into consideration. And being present in the community is just so important. Working with others, bringing others in, which is why we have our outreach department. And I don't want to get too into details about outreach because we have our director of outreach here. So I'll let her speak on that. But I would say that showing up, in people's lives way before they need healthcare is crucial.
I would agree with what Paola is saying. We have a lot of individuals in our community, our neighbors, who have trust issues. And so when we're able to show up at their church or show up at the shopping plaza or to show up at a recovery center or a homeless shelter, we're meeting people where they are beyond the clinic walls. And that makes us relatable. It makes us trustworthy. And so when we are able to show up outside the clinic walls time and time again and offer that compassionate care, the consistency, it makes us a trusted provider.
What message do you wish more people in the community heard about Central North Alabama Health Services Incorporated?
You know, I really wish that our patients knew how accessible and affordable and patient centered we are. I don't know about you, but I can't think of any other clinic that cares about what your barriers are to coming to get care. We have resources to try and provide you with transportation. We have resources to try and help you get your medication. So we're with you throughout this healthcare journey. We're managing your chronic diseases. We're also trying to prevent things. But I would love them to know that we're accessible, we're affordable, we're here just for them.
Excellent. Well, Dr. Cornelius, congratulations, by the way, on the designation of the level one age-friendly health system. Not something I hear very often with other FQHCs, so congratulations on that.
Thank you.
So, what does that mean in practice?
Well, it means that we have committed to providing quality care to our aging population. It's something that a lot of people are not aware of. And it's a recognition that's bestowed upon us by the Institution for Healthcare Improvement, with the idea in mind that our medical delivery should keep in mind the wants of that older patient. As you get older, some of your needs change. And so we try to identify things that are most important to the patient and tailor the delivery of the healthcare that we're providing to what they need, keeping certain things in mind.
So, for listeners that may not be familiar, can you explain the four M's framework and how it shows up in patient care?
That's an essential part of being recognized. We incorporate something what's called the four M's. First and foremost is what matters. We have patients that smokers, diabetics, have high blood pressure, but it doesn't matter to them. What matters is I just want to be able to play with my grandkids. So tailoring what we do to what matters in our healthcare delivery. So, for example, maybe reviewing their medications to make sure there's nothing that might cause them to fall, making sure there's nothing that make them sleepy, probably sending them to physical therapy if that's what matters to them because they want to be able to be mobile with their grandkids. So what matters, also medications. I learned during our process of becoming a level one site that a lot of the medications that the patients are taking are responsible for some of the symptoms that they're having. So anytime you have an elderly patient that comes up to you with a new symptom, the first thing you should look at is their medications. So reviewing their medication list actively, looking at their mentation. Uh, a lot of us, including myself, you forget things, but at what point do you have dementia? Is it something that is normal or not normal? So being more aggressive and addressing any mentation issues, cognitive issues that we routinely screen for doing our visits with that population. As last and not least is mobility, making sure they can ambulate. How quickly can they get up from their seat and go? Do they need to have rails at home, or do they need, yes, they can walk and they're mobile, but would it benefit them to have a quad walker or anything like that?
Well, we want to thank the whole team. We want to thank you for shining a light on the important work you're doing, and thanks for joining us today and giving us so much to learn from the work that you're doing. And best wishes with everything you have going on.
Thank you so much. We've certainly enjoyed this conversation.
Thank you for having us.
Yes, thank
Thanks.
you. This was very enjoyable.
Excellent. Appreciate your time.